The Bureau of Records. Accessing File 0-0-1. Subject: the Tuskegee Syphilis Study. A comprehensive historical and ethical analysis, 1932 to 1972. Classification: declassified federal research records. Status: verified truth. Opening file.
On July 25, 1972, a story moved across the Associated Press wires that stopped newsrooms across the country. For 40 years, the United States government conducted a fatal medical experiment on its own citizens. Researchers deliberately withheld treatment from hundreds of African American men, choosing to observe the slow, destructive progression of untreated syphilis. The exposure of the study shattered public faith in medical institutions and forced the nation to rewrite the laws governing human research. To understand how this happened, we have to go back to Macon County, Alabama in 1932. The Public Health Service had originally partnered with a philanthropic fund to treat a regional syphilis epidemic, but the Great Depression depleted the funding. The county was home to a rural, deeply impoverished population. Many were African American sharecroppers who had minimal access to basic health care. Rather than cancel the program entirely, federal doctors proposed a structural change. They would stop trying to treat the patients and instead run a prospective observational study on how syphilis damages the body over time. This graphic shows the makeup of the clinical cohort. The final sample size included 600 men, 399 who had already contracted latent syphilis, and a baseline control group of 201 healthy, uninfected individuals. None of the participants were told they had syphilis. Medical staff diagnosed them with bad blood, a local catch-all term used for ailments ranging from physical exhaustion to anemia. To ensure regular attendance at clinical checkups, the government offered hot meals, free rides, and a $50 burial stipend to their families. That stipend served a highly specific purpose. It functioned as a binding agreement allowing researchers to harvest their organs through full post-mortem autopsies. The men willingly submitted to painful procedures, like spinal taps, because they believed they were receiving standard medical care. In reality, they were trapped in a deadly waiting game. By 1947, the medical landscape shifted. Hospitals nationwide were distributing mass-produced penicillin, establishing it as the highly effective, definitive cure for early and latent syphilis. The Public Health Service faced a clear decision: administer the cure and end the trial, or protect their data. They explicitly chose to preserve the observational dataset and withheld the antibiotics. While their cardiovascular and central nervous systems deteriorated, the participants were handed low-dose aspirin and vitamin supplements to keep up the illusion of active therapy. By intentionally denying a readily available and proven cure, the researchers transitioned from passive observation into active medical harm. Sustaining a clinical deception of this size required aggressive intervention. During World War II, roughly 250 of the younger participants were drafted into the military. Routine physicals would have resulted in immediate anti-syphilitic treatment. To prevent this, researchers contacted local selective service boards and successfully secured medical exemptions specifically to block those men from receiving military health care. The isolation extended to the civilian sector. The federal team circulated lists of the enrolled men to private physicians and public health clinics across Alabama, with strict instructions to deny them any antibiotic therapies. As this timeline illustrates, the study operated in plain sight within the scientific community. Over 4 decades, the project published 13 detailed progress reports in major medical journals without encountering a single significant objection from the profession. It wasn't until 1966 that a venereal disease investigator named Peter Buxton filed a formal complaint. In response, a 1969 government review panel reviewed his concerns and explicitly voted to continue the experiment until the final participants had died. A network of institutional support and academic silence shielded the operation for decades, involving the highest levels of the federal medical establishment. After Buxton leaked the internal documents to the press in 1972, the ensuing national outrage forced immediate congressional hearings and the formal termination of the program. This chart of verified casualties reveals the physical toll. 28 men died directly from advanced syphilis complications, and 100 men died from secondary complications. The biological damage extended further. 40 wives contracted the disease, and 19 children were born with congenital syphilis. By prioritizing observational data over treating human beings, the government decimated entire family lines. In 1973, the NAACP filed a class action lawsuit on behalf of the survivors and their families. This resulted in a $10 million settlement and a federal program providing comprehensive, lifelong medical benefits to the victims. The revelation triggered a sweeping overhaul of the United States regulatory infrastructure, leading to the National Research Act and the creation of the Belmont Report. These mandates established the ethical framework for modern medicine, requiring the creation of independent institutional review boards and making explicit informed consent a legal requirement. In 1997, the federal government issued a formal apology. President Bill Clinton addressed the survivors directly, stating, "The United States government did something that was wrong, deeply, profoundly, morally wrong." Yet long after the lawsuits were settled, the historical memory of Tuskegee severely degraded trust in the medical establishment, particularly among minority communities. Sociological data indicates that this deep mistrust still affects patient behavior today, causing lower clinical trial participation, widespread vaccine hesitation, and persistent gaps in care. Rigorous ethical protocols serve as the essential bedrock of modern research, required to prevent institutional failures from manifesting as generational public health inequities.
File 0-0-1. Closed. The data presented is unassailable, sourced directly from federal investigations and the Congressional Oversight Record. The complete, interactive research notebook for this file is preserved in the ledger below. This is the Bureau of Records. Accountability is permanent. System standby. If you believe these records deserve to remain in the public square, interact with the system. Like this broadcast to signal the algorithm that this data matters. Subscribe to the Bureau of Records. Hit the notification bell to ensure you are cleared for access the moment the next file is unsealed. And share this video to help bypass the filters and expand the archive. Your engagement keeps the ledger open. See you in the next file.